because things are getting back to normal and case counts are coming down, and that's great. But if you are not vaccinated, then you are still at risk. And so please, 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 please go out and get the vaccine. Adults, we need you to get vaccinated. Those who are eligible, age 12 to 15. The good news is we now have over 14% of those ages 12 to 15 that are getting vaccinated. Again, we're climbing at a higher rate than the rest of the nation with those numbers. We now have over 61% of adults in the state who have at least one dose of the vaccine, and over 50% of adults in the state are fully vaccinated. Those are great numbers, but we still can do better. 57% of all eligible people, so that's everybody over the age of 12, have gotten at least one dose, and that number continues to rise. Our recent data suggests that of the people who have not been vaccinated yet, somewhere around 50% of them are still planning to get the vaccine. We're happy to announce that Moderna says its vaccine appears to be effective in protecting adolescents and plan to submit for authorization. Well, obviously, we already have Pfizer authorization for adolescents, but having Moderna available as well as they report and submit to the FDA in early June. So with that, it has never been easier to get a vaccine. Many counties, as we've reported, are starting to close some of their mass vaccination clinics. That's okay. We knew that would happen. That is by design. Again, those vaccination clinics were meant to get through thousands and thousands of people in a short amount of time. But we are transitioning now. We still have the same amount of vaccine available. We're just making it easier and closer to you. Most locations will let you now walk in with no appointment. It really has never been easier. There are places very close, wherever you are in the state right now, there are places that are closer to you than ever before where you can walk in and get a vaccine. It's also very easy to find a place to get vaccinated. You can go to coronavirus.utah.gov to search for one near you. There are local health departments and pharmacies, various grocery stores, including Rancho markets. We are helping to support vaccine outreach to our Hispanic community. And if I could just deliver a quick message to our friends in Spanish, las vacunas ya están en los departamentos de salud y las farmacias locales. También tenemos varias tiendas de comestibles, incluido los rancho markets, mercados, que están ayudando a apoyar el alcance de las vacunas en nuestra comunidad hispana. Estos son lugares familiares para la comunidad hispana. So again, so many opportunities for people to get vaccinated. This is it. This is the miracle we've been praying for. This is exactly what we wanted. Everything came together. Now we don't have any excuses for deaths or, again, thousands of people that have been hospitalized since vaccines have been fully available to everyone in the state. Now, in closing, before I turn it over to the Lieutenant Governor to talk about some of our equity efforts and our outreach efforts, I just want to say two words that sound very simple and yet are wholly inadequate. And those two words are thank you. Thank you to everyone in the public who's worked so hard during the past year plus to follow the physical distancing guidelines, to wear masks, to learn algebra and history and Spanish with your kids, to support your local businesses, take those options for dining out in restaurants to continue to support our local businesses and restaurants. We experienced so much firsthand what happened 100 years ago during the influenza pandemic, and as a people, I think we've learned a tremendous amount together. Thank you to our friends in the media who are here with us today and have been with us always, working to keep the public informed with safe and good and accurate information. Thank you to the public information teams who have worked so hard and cared so deeply for our communities, and have battled to continuously fight against the rumors and the misinformation and the conspiracy theories that are out there. We know you lost sleep, and some of you even lost family and colleagues. And we thank you. We feel you. I want to thank the business community for continuing to employ our fellow Utahns as one of only 2 states that actually saw business growth over the past year. We're so grateful for your efforts to keep the economy rolling, keep people employed, keep food on the table, even in the most dire of circumstances. Thank you for accommodating new styles and formats of work. Thank you for your resilience. We've proven once again that we can do hard things, and you did hard things, and it's why Utah currently ranks first in the United States for economic outlook. Thank you to our hospital and our medical community. We know you went through hell this past year, and we are forever grateful. Thank you to our teachers who have taught through the most difficult of circumstances, the most unfair of circumstances, and yet done it brilliantly and helped our kids to continue to move forward and progress and to learn. And thank you to our state and local health departments and practitioners for never giving up on us. When we made the wrong decisions, you stuck with us, and when we made the right decisions, you were there to help us through the most difficult of times. We needed you before, and we'll need you again. So stay with us. Thank you for what you're doing. Your work matters, and I am indeed personally grateful to all of you. So with that, I'll turn the time over to the Lieutenant Governor and then to Dr. Hoffman, and then we'll take your questions. Lieutenant Governor Henderson.
Thank you, Governor. Good morning, everyone. I just want to add my voice to the governor's plea and to go ahead and get vaccinated if you are not already. Yesterday, I attended my daughter's high school graduation. It was at the Spanish Fork Fairgrounds in the rodeo arena outdoors, and it was just incredible to see everybody come together, hundreds of high school seniors with their whole lives ahead of them, and parents and family members and loved ones and friends cheering them on as these events happen and as people begin to enjoy life as we once knew it. There's still risk and danger out there, and it's completely avoidable, as the governor mentioned. If you can get vaccinated, please stop putting it off and go ahead and get it done as we start to unmask and gather once again. The risk to those of you who are not vaccinated will continue to exist, so please do so. I have a quick vaccine equity update, and then want to announce the latest phase of our communications campaign. So in Utah, we're really proud of the parents who are getting their adolescents vaccinated. Last week, we reported that 9% of the 12 to 15-year-olds had received their first dose, and as of yesterday, we now have 14.2%, or more than 30,000 kids in this age group who have had their first dose. So that's really incredible, and we're happy about that. Vaccinations in our multicultural communities continue to improve. But as I've mentioned before, these numbers are slightly lower because we've added in a new eligible group, the 12 to 15-year-olds. So as of yesterday, 43.6% of eligible Asians have received at least one dose of the vaccine. 36.9% of eligible Hispanics have, 25.9% of eligible Blacks, 24.9% of eligible Native Hawaiians and Pacific Islanders. And to give you a comparison, 52.2% of the eligible white population have received vaccinations. So we still have a lot of room for improvement, and we will continue to work on this effort. Now we have nearly 1.2 million, or just over 46% of all eligible Utahns who are fully immunized against COVID-19. And 89% of people 65 and older have also received at least one dose, and 79% of this age group are fully vaccinated, which we're just really grateful for. Now we're pleased to announce the latest phase of our communications campaign it's called Get the Facts. So Get the Facts is meant to help people because doctors and pharmacists, they enjoy the highest degree of trust And we've asked them to answer some real questions that we've received from the public. Now, these questions are like, why do people who have had COVID need a vaccine? Or are the side effects of the vaccine worse than the disease? Or is it safer to get the vaccine than to get COVID-19? And did you have concerns about the vaccine? Those are some questions that have come in about in this campaign. Now, these people answering these questions are local doctors and pharmacists in Summit, Cache, and Tooele counties. These are your doctors and pharmacists. They've been vaccinated, and they want you to be vaccinated, and they want you to have the facts, accurate facts about the vaccine. So if you know someone who has questions about the vaccine, they should talk to their doctor. You're going to see these stories as you browse through social media, but you can also find them on the Utah Coronavirus YouTube channel or on Vaccine Education Resources page on coronavirus.utah.gov. This is an ongoing effort that we are undergoing to collect and share stories with you and get you the facts that you need to be fully aware. Thank you to everybody who's helping to protect yourselves and our community by getting vaccinated. Thank you very much.
Good morning, and thank you for having me here today. I wanted to start with an update on where we're doing with case counts, and we have good news this week. Our rolling 7-day average for positive cases is down to 245 per day. And that's from 328 per day a week ago. This is pretty dramatic, a very positive decrease in the number of daily cases. Our rolling 7-day average percent positivity, person over person, is 6.7%, which is the same as a week ago. And our rolling 7-day average percent positivity test over test is 3.9%, slightly up from 1 week ago. We've been talking for months now about the effectiveness of our 3 vaccines at preventing infections, at preventing serious disease, and most importantly, at preventing death. And the governor alluded to the number of deaths that we've had since we've opened up vaccinations to the public at large, 16 and older, which was around 70. If we go back to January, we see a really compelling picture about the effectiveness of these vaccines. Since January 1st, when we opened vaccinations to the public, there have been 120,933 total COVID-19 cases identified in Utah. 99.5% of those cases have been among unvaccinated individuals. There have been 5,016 people hospitalized, and 98.7% of those hospitalizations have been among unvaccinated individuals. And there have been 688 deaths from COVID-19 since January 1st. 99.9% of those deaths have been in unvaccinated individuals. These vaccines are safe. They are exceedingly effective. They are the magic bullet. If you have not been vaccinated, it has never been easier to do so, and we encourage everyone who is eligible to be vaccinated. If you need more information, talk to your provider. If you have friends and family who've been vaccinated, ask them what it was like. Seek out the information from the people you know and the people you trust, and please get vaccinated. Thank you.
Okay, thank you, Lieutenant Governor Dr. Hoffman. And with that, we're happy to take some questions.
Hi, Governor. I'm wondering if you can update us on your efforts to develop some sort of incentive for Utahns to get a vaccine. You talked about how you liked what you were hearing out of Ohio, and other states have since followed with vaccine incentives. In that case, it's a drawing. Someone just won $1 million, and someone else just won a full ride college scholarship. What's the latest here in Utah? Is that still something you're looking at, and what's going on with your plans?
Sure. Thank you, Lisa. So what we did in discussions with the legislature, actually, let me go back a little bit. it would be really great if we didn't need any incentives at all. Hopefully, like not dying is a great incentive, and so we'll continue to try to push those incentives for people, and hopefully that they'll respond. And again, our numbers continue to climb, and we hope that will continue as we make vaccines easier to get and take away any potential barriers that are out there. That being said, what we discussed with the legislature, and of course they hold the purse strings for the budget, constitutionally so, that we would come back to them as we watched what happens with vaccines over the next several weeks, and we would look at what happens in these other states, that we would do a comprehensive review of the efficacy of some of these efforts in other states, and that we would bring those back to the legislature with some proposals if we feel that those are still necessary. And so that's what we'll do. We're watching very closely. I have regular communications with governors across the country. In fact, we were on our White House call just this past Tuesday. A couple days ago, we spent time talking about what's happening in different states, and then every other week now I have call with Republican governors to discuss those incentives as well. So we'll watch really closely, see what's working in some states, what's not working, what's really made a statistical difference versus states that don't have any incentives, and then we'll go back to the legislature and see if there's an appetite to do something if necessary.
Governor, are you afraid you're missing a window, though, to get people vaccinated? It seems like now would be the time, and that's what other states have decided, not to wait. Why wait? Why not take advantage of the time that we're in right now, where people are still looking at vaccinations
Sure.
as something that needs to be done, as opposed to the further we get out, the more back to normal we get. There seems to be less incentive, less interest.
Well, the question again, if that's the case, if we're getting back to normal anyway, then the argument would be that we don't need incentives and that we're vaccinating enough people. So that's what we're looking at. Of course, we're very fiscally conservative in this state, and we should be. We're cautious with how we spend dollars that are coming to us, and so if it's not necessary, then we shouldn't expend them. And again, it shouldn't be necessary. That's the kind of the maddening thing and the frustrating thing. But we do everything cautiously. We get the best evidence and then apply it as we can in the circumstances. Again, as Dr. Hoffman just mentioned, our case counts are continuing to fall precipitously, which is great. Hospitalizations have not fallen as much. Of course, there's a lagging indicator there. We've seen some steady hospitalizations for several weeks now. We're hoping with this latest decrease in case counts that we'll see hospitalizations start to drop as well. But we'll watch those closely. Again, I mean, if an incentive works now, it will probably work a month from now as well. But we're not going to do it unless it's absolutely necessary. And it may be absolutely necessary, but we'll continue to watch and gauge that, and then engage with the legislature, who makes the ultimate decision on spending.
Good morning, Governor. Actually, this is probably more directed toward Dr. Hoffman. Could you mentioned the low level of so-called breakthrough cases, that only 1% or less of the cases of hospitalizations and deaths were people who are already vaccinated. Can you get into a little bit more detail about how many hospitalizations in Utah have been these so-called breakthrough cases?
So yeah, from the data that we shared, we'll know that the difference between 5,016 and 4,950, which is 98.7%. So what are we talking about? 66 cases have been hospitalizations related to breakthrough infections. And then we've had one death associated with COVID-19 after vaccination, among the 688 deaths so far.
Okay. Is there what can be done to reduce those even further?
So we have to have everybody vaccinated. We're not going to be able to prevent breakthrough infections from a vaccination without optimizing the vaccine to get at as many new variants as are coming. And our vaccine manufacturers are actively working on that. We expect that we will have boost doses. Our current vaccines do cover all of the circulating variants of concern, but not everyone who gets vaccinated has the same robust response. In particular, elderly individuals, we expect to not have as much of an immune response to the vaccine as a younger, healthier individual. And so the vaccines work. They're markedly reducing hospitalizations and death, almost eliminating it, frankly. And the best way to continue to reduce that is through improvements to our vaccines in their coverage of the circulating variants.
Thank you.
Thank you. Chris Reed, St. George News. And Governor, back on February 25th, people might remember this, you're holding your mask and you made a prediction that but right around July 4th, you wouldn't have to wear that mask anymore. I'm not going to ask you if you were confident back then of that prediction, because you had to be, but were you confident that before Memorial Day, that prediction would come true?
Well, I would say I was hopeful, Chris, that by Memorial Day that would happen. It was amazing looking back. If you remember where we were at that time with our cases, I took a lot of heat for the July 4th comment, and that people thought that was impossible. In fact, most people were predicting a fourth wave that would hit Utah in March significantly. Some of the models predicted that. That certainly became a media narrative, at least nationally. If you look at all the models then, they were really all over the place. There wasn't a consensus. There were some models that showed us continuing to decrease, but others that didn't. And so we were hopeful. Of course, at that time, we didn't think we'd be able to open up vaccines to everyone in the state until maybe May. But moving that up and being able to do that as manufacturers increase their capacity, and again, just the amazing response by our local health departments and our private sector partners in getting shots into arms quicker so the vaccines weren't sitting on shelves. All of those things combine to really move things up, and so it is interesting to go back, and I'd kind of forgotten about that, so I appreciate you bringing it up, Chris. And it's really cool not to have to wear masks everywhere right now because we are fully vaccinated, and to have beaten that prediction by a couple months.
As a follow-up for Dr. Hoffman, you've mentioned obviously statewide caseloads have dramatically come down. There are still certain areas, and I'll bring up Iron County here in southern Utah, they're still in the moderate range and haven't come down. If anything, either been plateaued or even gone up. What is it in places of Iron County that is not bringing cases down, that is continuing to see that darker blue on the map, so to speak?
Vaccination rates, really. We as we've said many times here, we're vaccinating, the cases are coming down because of vaccinations. Masking behavior is also critical. If you aren't vaccinated, we should still be wearing a mask. We should still be physically distancing. And so mask behavior in those areas also probably influences ongoing hotspots of disease that allow this disease to continue to spread.
Do you have any data at all about vaccination rates, specifically in Iron County or some of these other areas?
Not off the top of my head. They are lower in many of our rural areas of the state, but I don't have those numbers handy. Certainly can get you that information.
Thank you.
Thank you, Dr. Hoffman. We'll take one more question.
Good morning, Governor Cox. This is Rick Aaron from ABC4 News. As you mentioned, this marks the end of an era with the last regularly scheduled weekly update. I'm just curious, doing these as Lieutenant Governor and Governor for over a year now, what moments stand out in your mind, and what are your emotions as you stand up there for the last time as a weekly update?
Well, thanks, Rick. It's been a crazy year. I'm gonna miss you guys so much. That definitely stands out. I mean, it's amazing that we've been able to have all of these moments together. I know it's fairly uncommon. Governor Herbert and past governors have done kind of a monthly gathering where the press can ask questions, and so I don't think we've ever had this much access to the for the press, and I think it's been a good thing. I hope you felt it's been a good thing. We've certainly tried to be responsive and to answer your questions. You asked about some moments that stand out. Certainly those first few moments stand out. I mean, one that stands out is the very first press conference we did that none of you will probably remember, but the governor was actually, so this was in February of last year. The governor was in Washington, D.C., and it was myself and Dr. Dunn, and we were talking about how this we didn't think this was going to be a big deal, but we had to be prepared, and that the same things we would do to prevent the flu would prevent this, and there was just so little we knew about it. Certainly the one after Rudy Gobert and Donovan Mitchell tested positive, that was a big moment. I mean, you remember those were the 4th and 5th cases in the state of Utah, and kind of that was when everything changed nationwide. The NCAA tournament shut down, the NBA shut down, and then we had announcements around the Church of Jesus Christ of Latter-day Saints, their general conference, and then there was just kind of a domino effect that certainly happened after some of those big events were changed. So those certainly stand out. There's no question. Talking one that stands out to me is when we announced that we were preparing the Expo Center to receive patients in the case of hospitalization overloads, and then coming so dangerously close to having to do that. We were literally days, if not hours, away from having to triage patients and move them to that expo center, which was just awful. I mean, that's how close we came, and I don't think most people realize that. So those are certainly some of the days that stand out. I'm sure that there will be a lot of ink spilled in retrospect on this, and certainly this is not the end. And I don't want it to sound like it's the end. We'll still be back together and having these conversations. But it is a little bit emotional, I think, for everyone who's been involved in this response, and for everyone. Look, yesterday we talked about some major advancements that we're making in mental health care here in the state of Utah, in partnership with the state, the University of Utah, the Huntsman family, who has been so incredibly generous, and trying to move Utah from being a laggard when it comes to mental health care to being a worldwide leader in mental health care. But I certainly believe that everyone has been challenged. If you weren't challenged physically, actually contracting the COVID disease and the coronavirus, we've certainly been taxed and challenged mentally. And to see the trauma that so many people have gone through all of this. But most importantly, some of my favorite moments were the moments where we talked about innovation that was happening, the people coming together to support their neighbors, their communities, farmers feeding Utahns, trying to help the struggling businesses and enterprises and provide for those families who are at risk. Utah does that better than anyone else, and those are the moments I will take away from all of this. The good times when we came together as a state to help each other out and improve each other's lives. And again, I know I don't know how this sounds to you, but I really want to thank the media. I mean, I know that politicians and the media tend to mix a little bit like oil and water, and certainly I've taken my lumps from you all in doing your jobs. Some of it I agreed with, some of it I disagreed with, but all of it, through all of it, you are the mouthpiece. You are the trusted sources that people look to hold me accountable, to hold our teams accountable, but more importantly, to get good information to people, and you've performed that role as kind of the unofficial fourth branch of government as a check and balance and getting information to people, and that role is really important. And so far from being the proverbial enemy of the people, you've been a true partner of the people and a partner of government in the right ways. And so I hope that you've had trauma too. You've lost colleagues very recently, some of you, and it's been difficult. You had sleepless nights, and you had to figure out, some of you contracted COVID, and you had to figure out new ways to report and to do these things electronically. You deserve a tremendous amount of credit, and I'm not just blowing smoke. I mean that sincerely. I know we politicians feel like we never get any credit, and I know it feels the same for you. And so I hope you know that there are a lot of us out there that are pulling for you and grateful for the great work you've done. And with that, take a week off and go do something amazing, and then come and beat me up in a couple weeks or something. Take care, everyone.
Okay, that'll conclude our briefing for today. We're penciled in right now, June 10th, for the next time we'll get together. So thank you always to our interpreters in ASL and Spanish. Have a good day.